Gunnar Simonsen Thingnes is leader of Nursing on Wheels, a mobile harm reduction service based in Oslo, which provides harm reduction and healthcare to people who inject drugs. Gunnar is a registered nurse with a master's in nursing science. Please welcome Gunnar Simonsen Thingnes.
Thank you for the introduction, and thank you for inviting me to speak at this conference. I'm honored to be here. So, we are Nurses on Wheels. Just move this one. So as Dominic mentioned, Nurses on Wheels is an outreach harm reduction service working with people who inject drugs in Oslo. Our clinic is a car. We drive around and meet the people where they are, whether on the streets or in their homes. We come to them, they don't have to come to us. So, this is a guy who wants to be called Andy. He's a cheerful person, but after several years of injecting drug use, he has a chronic wound, as you can see in the photo. Andy receives wound care in our car as he struggles to get to the clinic downtown. We have several harm reduction and healthcare interventions. One of our main objectives is to reach the most marginalized people who inject drugs, people who wouldn't get help otherwise. These people have a 15 to 30 year reduced life expectancy compared to the rest of the population. And much of this can be explained by lack of healthcare. I will try to illustrate some of our work with a short story. A few years ago, my colleague and I received a phone call from a social worker. She was worried about her client's deteriorating health. As many of our clients, this is a person with mental illness as well as injecting drug use. Several studies have shown that this group of patients are stigmatized and struggles to access healthcare. And this was the case here as well. The person refused to go to a doctor. She did not want to go to the emergency room, nor did she want the doctor to visit her. However, she accepted a visit from Nurses on Wheels as she already knew us and trusted us. We were called to the patient's home. The social worker was worried about the client's reduced cognitive state and general condition. This is what met us when we opened the door. When people are under the influence of drugs, it can sometimes be difficult to establish whether the symptoms come from the drug in itself or if it's because of illness. And because of this, our nurses' clinical expertise is key. We immediately examined the patient and did our vital measurements. We quickly suspected that the symptoms came from the nervous system and brought the patient to the emergency room. We followed her through further examination before she was admitted to the hospital. We later learned that she had a full recovery. However, the consequences would have been much more severe had we not been there. Because we are on wheels, this gives us the flexibility to help people throughout the city, and especially people who struggle to seek out other health services. In this way, we are a social entrepreneur, always looking for new ways to reach the people who need us the most and contribute to close the gap in life expectancy between our patients and the rest of us. We are constantly improving our services, and the latest addition is a simplified model of care for immediate treatment with antibiotics. This is important because our patients often struggle with infections and access to treatment can be difficult. We also have a one-stop test and treat program for hepatitis C, as well as a comprehensive needle and syringe program. Last year we had more than 6,000 visits in the van. To conclude, we need a flexible service complementing the public services. I also have to mention that we have for the past 20 years been funded through the City of Oslo and the Directorate of Health. But as of this year, the Directorate of Health has cut us off. We would like to do more and expand our services, but are in need of more funding. Thank you.